And in order to honor his time, I'll briefly tell you that Dr. Not Dr. Little, I know your name is.
All right.
Sorry. He is the chief medical officer for Piedmont Newton, and he was part of an interview last week with David Kent, who is the CEO, and Andrea Lane, who is their community relations person with Piedmont Newton, and Debbie Harper, who is the president of the chamber. I found it so compelling that I invited him to speak briefly today about what is going on in Newton, what we can do to help prevent the spread of COVID, and where we look next. And I thank you, sir, for attending.
And David is joining us as we speak.
Oh, okay, great.
We certainly appreciate the opportunity to, work with our community where we, live and serve and work regarding the efforts around the COVID-19 pandemic. We are, I guess, in the midst of our fourth surge of COVID-19 patients that are requiring hospitalizations. We had, the initial with the March of 2020 when this all first began, and then July of 2020. We had a pretty significant increase in hospitalizations. But in December, January, February 2021, we certainly had a huge increase in hospitalizations related to COVID-19. And it's been probably 3 weeks ago, we began to see an increase, certainly related to the Delta variant. Approximately 97% of all COVID-19 infections right now are related to the Delta variant. So we began to see that. And the issue with that variant is that it's, significantly more contagious than previous versions. And we kind of measure that by saying that with the original version, if a person had COVID, they were likely to transmit that to 2 to 3 other people. With the current variant, the likelihood of transmission is more along the lines of to 8 to 9 other people. So you can see this is a very significantly contagious version of COVID. There are questions around whether it's a more dangerous version of COVID. And I think those questions are still being answered. But what we do see with the current outbreak is that with all the previous surges that we saw, the primary patient population was the elderly and chronically ill patient population, both in March, July, and then in this December, January, February. But this current surge is much, much different. There are two things that are of note that we really want to share with people. Number one is that we see many more patients hospitalized that do not have chronic medical problems and that are significantly younger. They're 20s, 30s, 40s, and 50s. And so the age of the patient that we're seeing become moderately to severely ill with the disease is a significantly younger and healthier patient population. So that's the first noteworthy difference between several months ago and now. And then the second very noteworthy item is that 95 to 97% of our hospitalizations. And when we say hospitalization, that's going to be a patient with moderate to severe COVID. 95 to 97% of those individuals are unvaccinated. So the current pandemic is really a pandemic of the unvaccinated population. And we occasionally see a hospitalized vaccinated individual, but it's quite uncommon. and generally they have some chronic underlying health conditions that seem to be contributing to that. Now, I don't want people to misunderstand. We do see vaccinated people that have breakthrough COVID, but they're generally very mildly symptomatic, and still it's not all that common. But we certainly have seen that. But in terms of those individuals that are requiring moderate to severe, or that are developing moderate to severe disease, it's predominantly in the unvaccinated population. The other important thing, that people need to understand is that, we have reached the same numbers of patients that we had back in the December, January, February surge. So, the volume of patients in our hospital with COVID is quite large, and it's putting a strain on staffing and resources, and overcrowding of the emergency department. And so this is not just a small number of people we're talking about. It's a quite a large number of people, and the details that I'm giving you now are not only true at Piedmont Newton, but they're every other Piedmont hospital, and really every other hospital in the Atlanta area is experiencing the same kind of situation. Largely unvaccinated individuals, 97% unvaccinated, a younger patient population, and we're still seeing these patients progress to very severe disease and death over time with this illness. So, those are the situation we see. The other thing that I would share in relationship to vaccination is that we haven't seen or hospitalized anyone with complications related to vaccination. I frequently have discussions with the physicians in the community, the primary care physicians, the pulmonologists, the cardiologists, and what they tell me is that they also have not seen in their office complications related to vaccination. But what they are seeing are patients that have had moderate to severe COVID, or even sometimes milder non-hospitalized COVID, that are having long-term effects from the illness, even 6, 8, 9 months after being sick with COVID. So, that's our kind of our current situation. We're constantly making adjustments, to try and accommodate the surge. We hope this will be short-lived, and praying for that, but we just don't know. It's hard to know, because around, I think the last time I talked to Dr. Arona, our director of public health in the area, we were still in our community about 60% unvaccinated. So that's a lot of people that could potentially develop COVID. And, with this illness, because it's significantly more contagious, it's more challenging to prevent the spread. So when we talk about masking and social distancing, some of those efforts are not as effective with a more contagious disease. It's not that they're not effective, but they're not as effective. So it's the chances that if a person is unvaccinated, that they're going to develop COVID is significantly higher, because this is a more contagious illness. But we still are, we do offer therapies on the outpatient side. So our primary care offices, if they have a patient that has COVID and they have a risk factor, they are age, or high blood pressure or diabetes, we are referring patients for monoclonal antibody treatments up in Athens currently. And we would recommend people take advantage of that, because they have been definitely shown to prevent the development of moderate to severe disease. So we certainly encourage that as a potential way to treat COVID, but it must be done before the patient is sick enough to require hospitalization. It's not effective once they're hospitalized and get that ill. So it's an early intervention that we have available for patients that do develop COVID. Testing has been an issue in the community. People are reporting that it's difficult to get tests, difficult to find tests. Vaccines are plentiful. You can go to any pharmacy, you can get a vaccine. But I do know that the testing resources for COVID have been stretched pretty thin here the last few weeks. So I just have a few minutes left. So if there are any questions I can answer, I'd be happy to do that. If you have anything that I can answer for you around vaccines or COVID or preventive measures, happy to do so.
Thank you so much, Dr. Norris, for taking the time to give us this information. I really appreciate it. I have a question as far as the, is it the monoclonal antibodies that you mentioned? Mm-hmm. What is the significance of that versus the third vaccine that they're currently recommended?
So the vaccine must be given in enough time to work. So if you're going to take a vaccine, it takes a couple of weeks for the vaccine to stimulate your body to make the antibodies to prevent COVID or prevent moderate to severe COVID. The monoclonal antibodies effectiveness is immediate. So it's useful in treating, it's kind of like giving an antibiotic, I guess, when somebody has pneumonia. So it's useful for the treatment right then, but it's not durable. So the monoclonal antibodies are not going to last but for a few weeks, and then they'll be gone. So the vaccine is still the best plan for long-term prevention. The monoclonal antibody is useful for somebody who has COVID, and we're trying to prevent it from developing into severe COVID.
Okay, thank you so much for clearing that up. I appreciate that.
I have a question as well.
Sure.
I heard from somebody that and this was a person in like local media, that the rate of 97% of hospitalized people are unvaccinated is flawed because they said that people aren't being tested. So it was something along the lines of, if you are vaccinated, they don't test you for COVID, so then you don't show up as positive. Can you speak a little bit to how that number's calculated, or is that true or not?
So, yeah, well, every person that comes in our hospital is tested. So that doesn't, that really isn't true. We test every single admission to our hospital. So when we say that 97% of them are unvaccinated, that's an absolutely accurate statement. Now, a lot of people aren't getting tested out in the community if they're not that ill or they're, but that's a different set. What I'm referring to are people that develop moderate to severe disease, and 97% of those people are unvaccinated.
Okay, thank you.
Are there others who may have a question about this?
I know that I came in late, but the conversation is great. I'm learning so much.
Welcome. Melissa wrote, how do we encourage vaccination? And I think that this is a great group for you all to, for Dr. Little and Mr. Kent and Andrea to address, because we are the trusted voices of many people who are hesitant to receive the vaccination. So I'll let Dr. Little address that, or Mr. Kent, whoever.
Yeah, it's a complex issue, and David, if you're on, you may have some other comments. We try to, work with people. I frequently need to have one-on-one conversations with people around that, and really, specifically address their concerns. Because their concerns are valid concerns, and I don't ever like to minimize people's fears or concerns around something. And so, try to really, I do not address what is being said in the, the media typically, or social media or the news. What I really like to share with people is what our firsthand experience is, what our physicians are seeing, what we're seeing in the hospital, because it's really real life data. There's not, I don't have an agenda. I wish all these people weren't having to come to the hospitals very sick, and many of them, end up here for weeks, and many don't survive. So we, I tend to just share. That's why why we speak to the chamber, why we're speaking to groups like this and others, just to help people to see what we are actually seeing, firsthand experience at Piedmont Newton and in our own community. So I think that's a helpful thing to do.
Yeah, and good to be with y'all. And I'm Norris's sidekick. I like this arrangement where you do all the talking and I'm just here for eye candy, Norris.
I'm going to have to drop off my other call, David.
We really just feel like we have a moral obligation to tell the truth to our community about what we're seeing in our community. And we don't have an agenda. What I've learned about people and the vaccine is that just for a variety of reasons in our society today, people have their opinions and their points of view about the virus, the pandemic, the vaccine, the politics around it, all of the things that kind of go into it. And what I've learned over time is that if you try to tell people that their opinion is wrong, or that, somehow they're not thinking about it the right way, or that they're, you label them based on their views on the vaccine and then apply that broadly across who they are as people, it generally is just not very effective for getting people to do what you think you want them to do. And so our approach has really just been to educate and say, here's what we're seeing, good, bad, and ugly. And, it is what it is. I can't force you to get a vaccine, or I can't force the people to get a vaccine. But what I can tell them is what we're seeing at the hospital. And I can certainly convince you that I have no reason whatsoever to be dishonest or lie or slant or paint this picture any differently than it is. And so, that's what we're trying to do with these Zoom calls. And, for me, I get everybody's opinion about it. I really do. And I respect it. I do deeply. People have good reasons for thinking the way they think. No issues with that. I just, somewhere in their head, I want them to understand that, we've got a hospital full of people who didn't get the vaccine and didn't think that COVID would happen to them, or didn't think that they would get this sick. And here they are, and they're in our ICU, and they're telling us, I wish I'd gotten the vaccine. So, that's just the fact. And so that's what we're trying to share with folks.
And I'd like to say something, and I'm sorry that Dr. Little has dropped off, and you guys can correct me, Andrea and Mr. Kent, if I'm wrong, but Dr. Little said he felt so strongly about it. He had a son who had two 13-year-old children, who he said, his son called him and said, should they get the vaccine? And he said, yes. And I see that someone has asked, can you offer any suggestions on how we would address concerns about the suspected long-term effects of getting the vaccine?
Yeah.
And I think that falls into that. So I leave that to you guys.
Yeah, the reality is we've only been given the vaccine now for, 8 or 9 months. Some of the original trial participants got it a year ago, and we don't see any long-term side effects from the year. But the fact is, we don't know 10 years from now what the side effects will be. We don't think they will be high because of the way the vaccine is made and how quickly the actual material contained in the vaccine leaves your body. We think any side effects are very short-lived, and we don't have any evidence that they're going to be long-term side effects. But we can't say that with 100% surety because we haven't lived that long to see it. What I can tell you for sure is that there are long-term side effects to COVID, and we're seeing that by the hundreds in our health system: cardiovascular issues, neuropathic issues, lung damage. It's a very real thing. And so, that I think that's the choice for people is, we don't have any evidence that there's long-term issues with the vaccine. We have very little short-term issue with the vaccine, but we got a lot of short and long-term issues that we're seeing with COVID. And so I think, that's the conversation I have with people. And just also incidentally, I have twin 11-year-old sons. They turn 12 in November, and based on what I'm seeing, they'll get the shot the day they turn 12. So.
Well, and if I can chime in, I also have 3 teenage sons. Hi, everybody. One I just sent off to college. He had both doses of the Pfizer vaccine, and I feel much more confident with him being off at college protected. And he did have COVID. He contracted COVID from an asymptomatic soccer teammate in the spring of 2021. And the facts are that your natural immunity is really not enough. Doesn't have as broad a coverage as the vaccine does. So that's why I made that choice for him. And then my younger sons are 17 and 14, and they will get their second dose of the Pfizer vaccine on Saturday. I do believe in it strongly. I believe in the safety of it, not only for myself, my mother, my children. Again, the facts are sort of staggering as to what's happening here in this hospital, and that people are becoming severely ill 97% of the time when they're unvaccinated. And it's hard. I think as a non-clinical person, I'm not at the bedside, right? Neither is David. But we are hearing code blues being called overhead. I mean, that's real. And we know that there are plenty of folks that are not surviving this illness. And then those that are, many have long-term side effects, like David mentioned before. And for me, I don't know. I have heard Norris say on multiple occasions that the likelihood of experiencing any side effects are going to probably happen within the first 30 minutes of receiving the vaccine. So we have a couple of women here in the hospital who were in the clinical trials last summer, have not had any side effects a year out, and have signed up to potentially do clinical trials for a booster if and when that time should come. So we believe it because of what we've seen, like David said. That's all we can go by. There is no bias here for us. All we can do is just worry about those who may get sick and severely ill, and that they can spread it to so many people that they love.
And I just saw in the chat, thank you, that someone's brother got Johnson & Johnson, but is now getting the Moderna because he had heard the efficacy and efficiency of the J&J vaccine is not very high. Is this true?
Yeah. Yeah, if you can, okay, I'm still not on mute. So the research shows that the J&J vaccine isn't quite as effective as the Moderna and Pfizer at preventing COVID, but that it is nearly as effective as preventing severe to moderate COVID as the other two. And so my advice would be, if you got the J&J, you don't need to get the Moderna, because what we're really trying to prevent here, you're not going to completely prevent getting COVID or even getting a little sick from COVID. What we're trying to prevent with the vaccine is people being in the hospital and in the ICU and ultimately, unfortunately, passing away. And when you look at the data from the two vaccines, it's very almost identical in terms of its ability to fight off severe COVID. So that's what I would say about that.
Okay, is there any? Oh, go ahead, Claudette. Go ahead. Oh, you're on mute.
No, I didn't have anything, Laura.
Okay.
Thank you.
Laura, if I could just say one more thing, I'd like to welcome all of you and the folks that you work with, or, you know, those of you on this call today. If you want more information, or if you'd like to come into the hospital and join us for a small group tour, we've given 17 community tours over the last 18 months or so, or about a year. I shouldn't say 18 months. It's been about a year since last July. And they've been very effective. And chances are we'll hang up today and you'll go, oh, I should have asked something else. You may certainly reach out to any of us, David or Dr. Little or myself, anytime if you have questions. But we'd also like to invite you to reach out to us to schedule a tour. And what we do is we kind of bring you in. We walk you through the path that patients entering the hospital walk now, because not every patient coming into our hospital right now has COVID. We're seeing, you know, people are still getting in car accidents and having heart attacks and strokes, and their gallbladders are acting up and all the things. We want to just reassure you that the hospital is certainly a safe place to come. So I will put in the chat box my email address. And if you'd like to reach out and be part of one of these tours, we'd love to have you.
Andrea, I did it for you. You're good. And one more question.
Thank you.
One more question. Are you all seeing any young kids hospitalized with COVID? Here in our community, we're not, because we don't treat children typically under the age of 18, but we do at our Columbus and Athens facilities, and we've also been in contact with Children's Healthcare of Atlanta, and we are seeing an uptick in children being admitted to the hospital with COVID-19, not to the extent that we are with adults, but we are seeing some of those cases rise. I don't have the data on it, but could follow up. And then looks like there are other questions. People, please address remasking. It would not have to be masked, but now yeah. So that's a great question about the masks. You know, and Norris and I agree with this statement that we really have a vaccine problem. First and foremost here, because we see that if you get the vaccine, the chances of ending up in the hospital are extremely low. And so if, you know, we encourage people to get the vaccine first. If you want to wear a mask as a replacement to the vaccine, understand that's not as good because of how transmissible the Delta variant is. The chances are you're still going to get the virus at some point. That said, you can get COVID even if you don't have any symptoms, or if you have mild symptoms, you can get COVID if you have been vaccinated. And so really the advice around masking is to not necessarily for protection of yourself, but it's protection of your friends, family, and other people that you're around. So that's really the idea there, is that even though, you know, you're not necessarily, we're not concerned about you getting severe COVID, we do know you can spread it if you have it, even though you've been vaccinated. And so that's why the mask really makes a lot of sense. And, you know, I'm not, you know, I'm not Pollyannish or pie in the sky about this. You know, wearing a mask is not fun and people don't want to do it. And they want to kind of get back to real life. And I see it all over our community, big crowds of people, you know, getting together and spending time together. My advice to you would be, when you're in those scenarios, to the extent possible, mask up or keep your distance. And, you know, if you're in a smaller group setting, you know, just keep your distance and be smart about it. That's what I would say. I see someone who, from Missy. Yep, Missy, thanks for your comment there. Yep, glad husband's doing well. And then, can I estimate the percentage of people who have COVID who end up in the hospital? I don't have it right on the tip of my tongue. You know, it's still relatively small. You know, it's not, you know, 40% or anything like that. The vast majority of people who get COVID don't end up in the hospital, even if they haven't been vaccinated. The problem is that the people who do end up in the hospital are in at real risk of losing their lives with it. And that's the challenge here. You know, if you're looking just purely at statistics, you say, well, you know, what have I really got to worry about? It doesn't affect that many people, except that this isn't, you know, this isn't something where if you get it, it's no big deal, and you spend a couple days in the hospital. If you get a bad case of COVID, you're going to be in this hospital for weeks on a respirator or ventilator, and you may not make it out of here. And you know, we're seeing that. And we went through the list yesterday with people that were on ventilators in our hospital: 40, 46, 52, you know, 45. These were people who statistically would say, well, I'm not going to get sick. Well, guess what? They are sick. And now, you know, their loved ones are very worried about them. And some of them, I really regret to say, will die in here with COVID. And so that's the problem with it, is you can really talk yourself into, you know, feeling not worried about it. And, you know, if you want to roll that dice, go for it. But I got I've seen hundreds and hundreds of people across our system that we're treating right now who wish they hadn't rolled the dice.
Right. All right. Well, we've taken a lot of your time. There are people who may want to do some networking afterwards, but are there any more questions before we let these wonderful people go? And I do have to say that last Friday I was scheduled for an MRI at the Piedmont and was able to start at the Knox Center and walk through the hospital to the main lobby and then be escorted by someone else into the imaging, the radiology area, and was in contact with no one else and felt very safe and well treated the whole time I was there. So I thank you so much.
Well, good. Well, we aim to please. We're working pretty hard right now, but I really want, we understand that we're in the service business, and we get a chance to help people at their most difficult times. And we're glad to do that. If you choose us, we'll do our very best to take great care of you. So thanks for having us today. Appreciate the time, and just connect with Andrea if you have any follow-up questions.
Thank you. And thank you, Andrea, for setting this up. This has been great.
Our pleasure. Anytime. Thank you. Stay safe, everybody.
You all do the same.
Thank you.
Okay. Well, that's a hard act to follow.
Laura, Superintendent Fuhrey is with us.
Oh, is she?
Would you like to invite her to speak?
Absolutely. The critical piece. Thank you so much, Ms. Fuhrey, for being here. Maybe George or Yvette or.
I'm sorry, Laura, I didn't hear what you said.
Oh, I said we'd like to thank you for coming, and we'd like to give you an opportunity to really share maybe what's going on or how we could help make things at all more bearable in the schools right now.
Sure. We are doing everything that we can and following the guidance provided to us by the Centers for Disease Control, our local health department, and our fantastic hospital partners, David and Dr. Little and Andrea. They've been so helpful to us as we've made decisions that unfortunately have not necessarily been popular in our community, like adding that we wear masks until we see the community transmission begin to decrease. And right now we're not seeing that. One of the things that I do is I regularly study the numbers that are available on the Department of Public Health's website, and I look at the cases and the 7-day rate of transmission and the rate of positivity, because in addition to taking care of all of the children we serve, we also have 2,800 employees that are impacted as well. And the health and safety and welfare of all of them are of critical importance. They are the number one priority to all of us, and to me, to the board. And so we are doing all that we can. We have continue to see an increase in the number of positive cases in our students, but we are responding and quarantining and following the regulations that have been presented to us in an effort to keep everyone safe. But as you heard David say and Andrea, the number one thing that everyone can do is get the vaccine. That will help us enormously if in our community we had a better rate of participation when it comes to the vaccinations. As you know, children under 12 are not eligible, and so that kind of represents all of our elementary schools and even some of our middle school students. And so we've hosted vaccination clinics across the school system to help our community become vaccinated, and we're in the talks of having additional clinics at our high schools so that students who are eligible can continue to participate and trying to make it easier for them to be able to do so. And so I think what I would want everyone to know is that we recognize as a school system that the best place to serve our students is in person, but given the construct of what's going on in our community, we have to respond in kind, and we have an obligation to protect all of the people who come to our school buildings every day, our bus drivers, our school nutrition team, maintenance, everybody. And that's what we're doing. So hopefully that helps give you a 50,000 foot view of what is going on. And we publish weekly our COVID data dashboard so that we can be as transparent as possible with our community and the people we serve in our community. So thank you.
And I hesitate to put you on, would you, I don't know if anyone has a question for you, perhaps?
They may have questions, but I don't know if I'll have all the answers.
That's good. Well, that's fair. Is there anyone who has something other than to say thank you? I can't imagine being in your position right now, and have the schools in our prayers.
Well, thank you. Well, I appreciate that so very much. We have a really fantastic school system team, some of whom I think are on this call. And I'm incredibly proud of them and the work that they do to serve our students and protect themselves and help us to remind everyone to protect each other.
Okay. Thank you for that. Thank you for being here. Okay. Anybody have anything to ask? Okay. Well, Ms. Fuhrey, I think you've done oh, Kenyana.
Hi, I'm sorry, I had to take a call, but I do have something to share. We do have an upcoming mobile distribution event. It will be in Stockbridge. I can get that flyer over to you, Laura, if you would like. It's going to be at Light of the World. It's going to be a community block party, and we will be there distributing out products. So I can send a flyer over to you and then have all the information on there.
Okay, is there more for the good of the common? Things going on?
Laura, just one thing I would like to add that I should have mentioned earlier that folks on the call might be able to help us with, and that is to help convey the message in the community that the school system is acting in response to the data. So that's what I've done since March of 2020. And whenever data is available to us, we then act accordingly. And I think that's really important for people to understand the decisions that we are making. So we started the school year with a mask optional requirement. So if you wanted to wear them, you could. If you didn't, you didn't have to, because the data at that time supported that decision. But quickly, in 1 week's time, we had 85 kids who were impacted, staff members who were impacted, and then the community itself began to see a tremendous increase. I mean, almost 50% overnight. And so you don't really have an option once you see those numbers. You've got to respond in kind. And I don't know that everyone in the community understands that it's not Samantha sitting here behind the the screen like the Wizard of Oz, you know, making up stuff. I'm actually looking at data and then responding to the data by putting in mitigation strategies so that we can stay in person, right? Because I'm trying to avoid having to shut schools down and go to a virtual setting. And so if everyone could help us communicate that message, I do videos, but sometimes the videos are not enough. Word of mouth helps a lot. So that would be great if we could help with that and then help spread that message that that's how we are responding. We're using the data, the science, and then the medical professionals who are definitely advising me. I talk to the hospital people and Dr. Andrea Rona pretty regularly when it comes to making those kinds of decisions. So that would be great if we could get some help there.
That's exactly why we hosted this call today, to get this into the people who work with our families who are concerned. So hopefully we will all be doing that. Thank you. Okay. More? Y'all have been great participants. This has been as compelling as the piece I heard on the chamber last week. I think we beat them for great response on the hospital's part, and that we also got Superintendent Fuhrey engaged in this as well. Thank you for that. And on behalf of our families, it's a critical time.
Laura?
Yes.
Can I share an event?
Yes.
Also,